lot of people that will come to me saying that they have a sex addiction or they have a pornography addiction. And when you talk with them, you realize that this sounds very normative. Like these are like very normal, healthy behaviors. But for some reason, there has been this like stigma placed on it. Where they feel that these things are bad and that these things are dangerous for them. And okay, in what way are they dangerous for you? Are they dangerous for you because it's led to where you're watching porn all day and night and you're not able to do the things that you want to do in your life, such as go outside and go to your job and have a relationship, whatever it may be, that it's invading your space and that you're having difficulty controlling this for yourself and that it's becoming something that is obsessional? Or is it that you enjoy it and that it's fun for you and that it's exciting and pleasurable? That is something that can be very normal, but is something that the stigma can really be harmful for. And so that is something that I'll often talk to people about when they come to me. The idea of sex addiction in general, what does that mean? This is not really something that is 100% a true diagnosis. Is this individual someone that it is interfering with their ability to do the things that are important to them? Is it causing them issues in like their ability to live their life? Why is that? Is that because of the stigma around them? Or is that something more inherent to what they're doing? Because just because it might be causing difficulties in your relationship doesn't mean that you have a sex addiction. It means that you probably need to go to couples counseling and sex therapy, sex counseling to discuss that. There are a lot of layers there, and so I think it's really important for folks to understand it. However, I do get occasionally people that will come to me that are struggling with more of what we call like hypersexuality, or sometimes referred to as like a kind of sex addiction, that it is interfering with like, they're feeling like it's hard to do those things that they want to do. And that there are some ways to treat that. Is it kind of getting in the line where they're like worried that they're going to get into some trouble because they're like, going out and doing these things in public that's not safe to do that for other people or themselves? Like, it is something that is a kind of fine line that we have to look at and be careful with, because you don't want to really shame someone when there's already so much stigma there. It is an interesting area, and I think is an area that continues to need more research of like, how do we define these things and what is the healthy way to think about it? Are we just basing this off of what is considered normative sexual interest, or just because this is a smaller kind of minority of people that have this interest, but it's safe, it's consensual, then we should really think about why are we considering it to be this illness.